Well, last week, we received the sad news that the wife of former MP Chan Soo-sen had died of a rare brain disease which affected her ability to sleep. Mrs. Patricia Chan is said to have suffered from fatal familial insomnia. It's a hereditary genetic disorder which manifests suddenly in middle age in Mrs. Chan's case when she turned 57 in April this year. So to help us to better understand what it's all about, I have with me in studio Dr. Lim Li Ling from the Singapore Neurology and Sleep Centre. Doctor, great having you in studio. Thank you for coming in. So it's something that's not so easy to understand because it's not so common. Fatal familial insomnia. What exactly is it?
Fatal familial insomnia is actually an extremely rare inherited condition in which there is a genetic mutation in the prion protein gene. So prions are actually natural proteins which occur in the brain, and when they are abnormal, as in the case of a mutation, then it causes the normal structures in the brain which mediate normal sleep. One of the structures is called the thalamus, and it actually degenerates and there's cell loss. So when this structure which creates normal sleep is affected, the patient will present with a progressive inability to sleep. So the sleep is extremely chaotic and disorganized, and of course the patient can only enter into very light sleep, and because of the extreme lack of sleep, they will present with, besides insomnia, they will have mental and psychological type of presentations like hallucinations and dementia.
I suppose what the message we need to get out there is that this is a very rare disease.
It's extremely rare. I think the man in the street doesn't have to worry about it. There's only a handful of families worldwide. It is inherited, and only a few, maybe about 100 case reports all over the world. So this is an extremely rare condition for which the average person probably doesn't have to worry about.
All right. So the disease, of course, underlines the importance of sleep to everyone. Yes. So what constitutes normal sleep and good sleep?
Okay, normal sleep actually has three forms. There's light sleep, deep sleep, and dream sleep. And usually we have about 50% light sleep, 25% deep sleep, and 25% dream sleep. So what's normal is that you have this normal complement of light sleep, deep sleep, and dream sleep. The other thing that's normal is that we need a normal quantity of sleep. So if you're a newborn baby, it's 16 hours. But if we're talking about adults, most adults require anything from approximately 6 to 8 hours of sleep. So both the quantity and the quality are important. And often when we see people with sleep disorders, they either are not getting enough sleep, the sleep is fragmented or interrupted by a condition, or that either they're not getting enough sleep or they're just getting light sleep. It's not very deep sleep at all.
So what happens when we don't get enough? Are there signs that we may not even be able to detect in our daily routines?
Yeah, most of us are probably familiar with not getting enough sleep. And the most serious organ that's affected by lack of sleep is actually the brain. So when we don't get enough sleep, we feel very sleepy. And what is really important about that is that a lot of people lose insight, especially the more lack of sleep they have, they become very sleepy. And the most immediately life-threatening is probably lack of attention and vigilance. So people who drive or operate machinery, lack of sleep is actually one of the reasons why car accidents, road traffic accidents, industrial accidents occur. Because people have a lack of attention and vigilance, and then they just nod off. They have micro sleeps. Yeah. So a lot of road traffic accidents, one of their known and unrecognized causes is actually lack of sleep.
Interesting. So what have you observed in Singapore over the years? The many patients you've seen, is the condition, is the number of people being sleepless going up?
Yeah, I think it's probably a function of the fact that Singapore is a rather fast-paced and hectic society, and there are many segments of society that actually are predisposed to lack of sleep, like shift workers or mothers of young children, or people who work in international markets, so they might have to be up late at night. So since there's more things to do as well at night, in the old days when it got dark, there's nothing much to do. Now we have 24 hours shopping, internet, there's so many things you can do. So a lot of people are probably a little bit overstimulated and they have a lot of things to do. And it being a rather competitive society, people try to do as many things as possible. Then they cannot enter a state of relaxation, which is required, just before we go to sleep.
So one last question for you. How are sleep disorders normally managed? And at what point would I have to think to myself, maybe I need to seek medical help?
Well, if you have the occasional inability to fall asleep because of stress, which is very common, then that's okay. But once the lack of sleep and inability to fall asleep affects your quality of life, like it affects your work performance or school performance, or you start to feel very depressed, or you get into accidents, or there's a real dysfunction in terms of family or interpersonal relationships, that's probably when you need to seek help.
Okay.
Yeah.
Thank you very much for coming in today.
Sure,
it's great speaking to you.
Okay, fine.
And that was Dr. Lim from the Singapore Neurology and Sleep Centre telling us more about sleep disorders in Singapore.